I always think one of the interesting things is more and more, we think about vaccination in pharmacy and older people, we think about shingles and, hey, they need the flu and stuff like that. But a lot of younger people now, unless their employer makes them, don't have a primary care doctor. They don't know that it's time for my tetanus shot because nobody's keeping up with that, right? And so if you think about as care gets cheaper, and if they get a sinus infection or something like that, they do one of these $15, they text the doctor, and that doctor's not going to tell them, oh yeah, by the way, you're due for your tetanus shot. It's going to be serious. You get out of whack your tetanus, and there's other shots that have a recurring stuff like that. So we really have to be figuring out how, I almost think, maybe if, it's in their plan, I think a pharmacy should be vaccinating. I think if a pharmacy that's going to have a future, that's going in the future, that's going to be a health destination.
But also that age demographic isn't necessarily going to a pharmacy.
Yeah, that's a good point. But they
get the flu.
They drive by one most likely.
They're going for their sinus infection. Yeah. And more that's where they're going to go. They're going to text a doctor in a box, and they're going to take a picture up their nose, and they're going to get an antibiotic for sinus infection, whether they have a sinus infection or a cold, and they're going to go to the pharmacy and they're going to get it. All right. So as a wrap up, though, you are very involved in operationalizing vaccine programs at Discount Drug Mart.
Yep.
Right.
We actually have a registered trademark where we are the immunization destination
in a very community oriented fashion. So what advice as a wrap up would you give to pharmacies doing a vaccine program today or thinking about doing a vaccine? What are some of the key portions of successfully operationalizing a vaccine program?
Having a relationship with STChealth for starters, and making sure that we help you with your vaccine operations, and then are helping you, maybe even more importantly, on informing your closing of gaps and where the opportunities are. But I think you want to have a mindset of flexibility. We were all day, every day, walk-ins welcome, except when, the P word came along, and we needed to be, for the sanity of our pharmacy staff and for our patients, have appointments.
Yeah.
So the balance of, when I said if the moon and stars align and somebody's willing to walk in on a Tuesday night to get their flu shot because whatever reason it was happening, the last thing you want to do is be able to say, I'm sorry, you're going to have to come back and make an appointment.
Right.
Have the flexibility.
You're going to have to make an appointment, or you're going to have to go see your GP.
Create the bandwidth and understand that is patient care. That is creating, I don't like this word, stickiness with your patient. And maybe some things are going to change related to the reimbursement associated with putting pills in the bottle. But I think there are too many pharmacies willing and able to do that, which is some of the reasons we're in the situation that we are, not to excuse any of the activity that's outside of our control based on a number of, but I don't know that there are too many pharmacies willing to do the right thing, such as vaccination and other clinical services. So I think flexibility is, make it a priority, and understanding that your customer, your patients, you want to be very flexible for them. So do your best that you can in creating the ability for walk-ins welcome. At the same time, if you can work with STChealth and Pioneer RX or whomever else it may be to automatically identify where these gaps in care are, to then engage in an automated way that might not even include human beings, that because you have this patient who trusts this avenue to communicate them with, to say, Mrs. Smith, I noticed you scheduled your flu shot. Why don't we take care of your tetanus while you're here? I mean, nothing novel or you guys probably haven't heard before, but the more you can make that automatic and boiling it down to that interaction between the pharmacist and the patient at that time, taking away the administration stuff on the periphery, that's what we need, because from a revenue and tailwind perspective of where those opportunities were, you have to dig a little bit deeper to find them. And I don't think you want your pharmacies to go fishing for them as they're looking at somebody's profile.
Yeah. You want the system to kind of do it for them.
Yes.